we will discuss about the various types of diabetes. The underlying cause of diabetes varies by the type, but no matter what type of diabetes you have, it will lead to extra sugar in your blood. Too much sugar in your blood will lead to multiple serious health issues. There are different types of diabetes, like for example the first one is called type 1 diabetes. It's usually diagnosed in young children, although it can occur at any age. The exact cause of this type 1 diabetes is not known, but what is known is that your immune system, which is usually needed to fight against bacteria or virus, inadvertently attacks your pancreas cells. This leaves with little insulin in your body. So instead of being transported into your cells, the sugar builds up in your blood. And type 1 is thought to be due to a combination of genes or environmental factors. Exact reason of this is still being investigated. Although we know that weight is not responsible for type 1 diabetes. Now people with type 1 diabetes need to take insulin daily to remain healthy and for their sugars to be balanced. Now coming on to type 2 diabetes. If you have type 2 diabetes, your body does not produce enough insulin or the insulin is ineffective. You can develop type 2 diabetes at any age, even during childhood. This type of diabetes occurs most often in middle-aged or elderly people. It's the most common type of diabetes in adults. In type 2 diabetes, your cells become resistant to insulin. So, insulin cannot do its job well. Your pancreas is unable to make that extra insulin to overcome this insulin resistance. So, instead of moving into the cells, this blood sugar gets trapped in the bloodstream and your blood sugar keeps on increasing. Exactly why this occurs is uncertain, although it's believed that genetic and environmental factors play a role in this type of diabetes also. But what we do know is that being overweight is strongly linked to development of type 2 diabetes, but rarely even lean people can get type 2 diabetes. The remaining two types of diabetes are the reversible types of diabetes like gestational diabetes and steroid related diabetes. Now coming on to gestational diabetes. It occurs during pregnancy and resolves once the baby is delivered. Now during pregnancy, the placenta produces multiple hormones to help sustain the pregnancy. Now these hormones makes your cell more resistant to insulin. Your pancreas usually respond by producing enough insulin to balance this, but rarely the pancreas cannot match up. When this happens, either too little glucose gets shifted into your cell and too much of it stays in the blood. This results in gestational diabetes. The last type of diabetes is steroid related diabetes. Steroids make your cell more resistant to insulin, hence sugars are elevated. Again, this resolves once steroids are stopped.